on where you're joining from. And I would like to welcome all of you to the webinar series from the APPNA MERIT Research Committee. We had a little break over the winter holidays, and now we are restarting. So today is our first new session for the new year. So Happy New Year to all of you. And for those of you who have not joined us before, just a brief introduction about myself and the panelists and the committee. So my name is Sarfraz Hasni, and I'm a rheumatologist by training, and I'm a director of lupus clinical research at the National Institutes of Health in Bethesda, Maryland, in the United States of America. Our panelist today is Dr. Syed Uzair Al-Ghani, who's really the force behind these webinars, and he's a healthcare management consultant, faculty North American College Director of Canada Pakistan Research and Development Council, and we're also joined by our panelist, Dr. Sarwat Hussain, who is a renowned radiologist and has done a lot of work in the healthcare education and radiology. So a brief introduction about what we are doing here and who we are. So we are part of the Association of Pakistan Physicians of North America, or APPNA, and we are the APPNA MERIT Research Committee. So MERIT stands for Medical Education Research, Medical Education Research, International Training, and Transfer of Technology. So under the APPNA Merit Research Committee, the President-elect of APPNA is Asif Mohideen, and APPNA Research Committee is now being led by Dr. Naveed Sadiq. And so the APPNA Merit Research Committee is committed to promoting medical education, research, and technology transfer, and bridging technology from North America to Pakistan. And we have been conducting these webinars for the last 2 years, and all of these are archived in our YouTube channel. And you can, for example, for today's session or anything that we have done over the last 2 years, you can do that. And in addition to that, Dr. Ozair has collected a lot of research resources on the WhatsApp group. So please join that or join our YouTube channel. So as I said, we have conducting these webinars for the last 2 years, and we have provided the platform to medical institutions, research centers, clinical research organizations, life sciences groups, and technology partners. And we have provided many live streams for clinical professions, and you can find the link in the Zoom chat box. And YouTube's videos are available on the APPNA Merit YouTube channel, and the link is also provided in the chat box. And if any of you are interested in presenting from your research from your organization in future, please contact us either online or offline. So this is a brief introduction of what we're doing and just sort of a recap of where we are. But today we are very excited and honored to be joined by Dr. Shafiqul Rehman, who's the Chief Executive Officer at the Rehman Medical Institute. So Dr. Rehman is a accomplished healthcare executive with a strong track record of strategic leadership and operational management in healthcare industry. As a CEO at the Rehman Medical Institute, he has been instrumental in transforming RMI into leading tertiary care hospital and a leading provider for higher education in Peshawar, Pakistan. He has a diverse educational background as an MBA in International Hospital and Healthcare Management from Frankfurt School of Finance and Management, and certificate in healthcare leadership from institutes like Solid Business Institute, University of Oxford, London Business School, and Harvard Medical School. And he has consistently demonstrated his commitment to personal and professional development, continuously seeking to enhance his own skills and knowledge. He's passionate about the potential of technology and its transformative impact on healthcare, and he has been his keen interest in working with startups, including health in the health tech space. And he actively engaged with startups as a mentor, advisor, and with his background navigating the challenges of the healthcare industry. And he's excited by the innovations in health tech and recognizes potential to address the pressing challenges faced by the healthcare sector. So that's a brief introduction of Shafiqur Rahman Saab. And now I will hand it over. But before I do that, just a housekeeping rule is that usually we try to limit the talks for about 40 minutes or so. And then after that, we open it up for some discussions and answering some questions. So if you have any questions, please put them in the chat box, and we will try to get to all of them as much as possible. But if we also want to make sure that we stay within our 1 hour time limit. So with that, I will hand it over to Shafiqur Rahman, and please take it away. Thank you so much for taking time to do this.
Thank you very much, Dr. So first, a clarification. I'm not a doctor by training, so I am Mr. Shafiqur Rahman, but thank you very much. I'm commonly taken as a doctor in most circles. So thank you, APPNA MERIT, Dr. Uzair Saab, and all the team members for giving me this opportunity to talk about RMI and the impact that we've had in Pakistan overall in terms of healthcare services, education, and research. I'll start off with a very quick introduction about myself. I grew up in Karachi, went to school in Karachi, did my O-levels, A-levels in Karachi. I did end up in a medical school, which is the Khyber Medical College in my hometown, which is Peshawar. A year later on, I realized it's not for me, and I moved on. I did my bachelor's from Kent in Canterbury, and then I went on to do an MBA in international healthcare and hospital management from Frankfurt in Germany. Thereafter, I've been working in Rehman Medical Institute for a little more than a decade now. And over this time, I've had the opportunity of attending different programs at leading international institutions, largely involving healthcare leadership. So I'll just be touching upon briefly the healthcare landscape in Pakistan and the importance of clinical research, and then I'll move on to Peshawar and the impact that RMI has been having in Peshawar and the wider region over the last decade in terms of healthcare research and education, and some of the services that we have that we are very proud of. First of all, as all of us know, our population has grown exponentially over the years. Healthcare is one neglected segment by and large. Whichever metrics you look at, the disease burden is rapidly growing, and the health system is just struggling to keep pace with it. The importance of clinical research cannot be overstated. This is one area where we're lagging behind as well, unfortunately. And the importance of clinical research in terms of early disease detection and ensuring that we're able to provide the best possible care to our patients is an area that is of great focus to RMI as well. Peshawar is located at the northern part of Pakistan in the province of Khyber Pakhtunkhwa. It is located very close to the border with Afghanistan, which is why for many decades now, it has been a city which provides all kinds of services to the wider region. So that is why when RMI started its doors in 2002, Afghan patients constituted the major chunk of the patient population that were coming to RMI over the years. And since then, we have diversified, and now we've got patients coming from all over Pakistan and the wider region. But it's a very important strategic location. And unfortunately, it's been in the news for all the wrong reasons. We've had a lot of difficulty with regards to the socioeconomic and the security conditions in this part of the world, which has been a major challenge, but that's what makes this impact so much more important. So about RMI, as I said, we're located in a place called Hayatabad in Peshawar. The story of RMI dates back to 1991 when I found the chairman, then working in Karachi. He was an eminent cardiac surgeon who worked in Karachi for many years. And he would come across all these patients traveling all the way from Peshawar to Karachi and many other cities to avail cardiac services, cardiology, cardiac surgery, and so many other services that were not available in Peshawar at the time. Private healthcare as a single institution with services under one roof was an alien concept back then in Peshawar. You had a lot of clinics, you had a lot of smaller centers, but quality healthcare was very hard to find in the 90s. And one of the reasons for that was generally private enterprise felt it's not feasible to invest in quality healthcare or facilities of this stature back then. And it is with this vision back in 1991 that our founder chairman decided to invest in healthcare right here in Peshawar. And the vision back then was not just to establish a single hospital, which is why the name Rehman Medical Institute was meant to focus on all three verticals, whether it's healthcare, education, and research. And this goes into our charter, which we've been following since then. RMI finally opened its doors to the public in 2002. It started with one block, largely focusing on a few services, mainly revolving around cardiology and cardiac surgery, specialities that our founder chairman was associated with. But it rapidly grew. We started with 50 beds back in 2002, and it then rapidly grew to a number of disciplines. We had pediatrics, gynecology, and thereafter orthopedic surgery, and so on. So 2002 was, as we all know, was a very challenging time for the region as a whole. The Afghan war, the American invasion of Afghanistan, there was a lot of turmoil, but there was also an opportunity whereby so many patients from Afghanistan were very much dependent on Pakistan and Peshawar in particular for healthcare. There was a lot of transition in terms of the healthcare system in KP back then as well, which is why a lot of senior practitioners from the government service decided to opt for private practice, and many of them decided to join RMI. Our growth has been quite exponential in the initial years. Within a few years, we expanded to our full capacity, which existed at the time, which was about 250 beds. And since then, we've expanded to a number of specialties. I've identified a few of them here. Cardiology, cardiac surgery, I've already talked about. Orthopedic surgery, neurosurgery, neurology. Renal transplant is a program that has been started more recently in the last few years, but alhamdulillah, in a very short span of time, it has grown a lot, and we now get patients from different parts of the country and different parts of the world as well. We've got general medicine, general surgery, all the specialities that are required for a medical school. But even otherwise, there are specialities that have been very innovative for this part of the country. Center for Reproductive Medicine and Interventional Radiology was one of the first centers in this part of the world. Just some numbers, we treat a little more than 200,000 patients a year. We have more than 40,000 admissions. We have more than 90 consultants, 60,000 other lab tests, and 80,000 scans a year. So when RMI started in 2002, there were numerous challenges, but one critical challenge that we faced was the lack of quality HR. A hospital is much more than a brick and mortar structure. It's much more than just a structure which has all the equipment available to it. Like most service sector organizations, healthcare is very much dependent on the HR to deliver healthcare. And that is where Peshawar was very much lacking at the time. And it is with this vision that in 2008, we established our first educational arm, which was the Rehman College of Nursing. Nursing education was again not very common in Pakistan, at least in the private sector back then. It was a diploma nursing program. It largely existed in the public sector, but in the private sector, it wasn't deemed to be very lucrative financially or otherwise. But the vision again was we had to produce quality nurses to support our own institution and over a period of time to help raise the quality of healthcare in the wider region. Soon after that, we had a dedicated campus set up for the Rehman Medical College, which in 2010 established itself. And alhamdulillah, over the years, we now have alumni serving in various parts of the world in different specialities. It's duly accredited by the PMDC. We're affiliated with the Khyber Medical University, which is located very close by. Yeah, we have all the other relevant affiliations as well. Physiotherapy was a specialty that had not developed much back in 2012. And yes, there were physiotherapists, but a doctorate of physiotherapy program, there were only a few of them existing at that time, and those two in the bigger cities of Karachi and Lahore. And therefore, in 2012, the Rehman College of Rehabilitation Sciences established. We had a physiotherapy department since 2002, and we felt there's a dire need for us to expand services, not just at our own facility, but in the region as a whole. So the Rehman College of Rehabilitation Sciences started in 2012 to offer a doctorate of physiotherapy program, and it has now expanded to a number of other programs, including the speech and language pathology, occupational therapy, and so on. In 2011, we were producing doctors, we had a nursing program, we were doing rehab sciences, but we then realized that there is a number of other disciplines where a university degree is not offered, and you have diploma, you largely have the apprenticeship model. So whether it's technicians in the lab, whether it's technicians in the OR or the radiology department and a number of other disciplines, there wasn't a structured program affiliated with the university. There wasn't a university degree that was being offered in many of these paramedical disciplines, as they're commonly referred to. And it is for that gap to be filled that we established the Rehman College of Allied Health Sciences. So early on, the first program under this college that we started was medical lab technology, because diagnostics was a major function at RMI, but it's now expanded to almost 7 disciplines. So we're offering a BS program in surgical technology. We're having a program in cardiology technology, anesthesia technology, radiology, emergency medicine, medical lab technology, BS in public health, and BS in vision sciences. And we've got a respiratory therapy program in the pipeline, as well as a dental technology program that we're hoping to start next year. And the last college that we've established was in 2016 on our campus, which was the Rehman College of Dentistry, offering a BDS program in dentistry. And there's a new dedicated campus building set up for dentistry, which we intend to move into later in 2024. Phase 1 of that campus has started already, but we're going to fully move into that campus later this year. Dentistry is another discipline which I think has not been served very well. There's a dire need of qualified specialized dental practitioners in Pakistan. Dental hygiene and dental care overall needs to be substantially upgraded, and it is for that gap that the Rehman College of Dentistry was established. We have a central library on campus, electronic library, conventional library, and all the other journals. A postgrad program has existed at RMI since 2006, because we realized that having an undergrad program was only the starting point, and we wanted to continue providing specialization programs in a variety of disciplines, since we have the clinical infrastructure, and there was a need for us to have these specialists joining the workforce as well. And over the years, we offer FCPS in a number of disciplines, MCPS, and then we've got fellowships in various disciplines as well. Here's just a list of the postgrad programs that we're offering here at RMI: anesthesia, cardiac anesthesia, cardiac surgery, cardiology, gynecology, and so on. And in some of the disciplines, RMI is the only center right now which is offering these programs. Furthermore, over the years, we've had collaborative arrangement with different government entities, whereby RMI is a training center for trainees that are sponsored by the government. Our research activities, research has been at the very heart of what RMI does. So as I mentioned, back in 1991, we determined that research is going to be a very central component of what the Rehman Medical Institute is going to do in terms of the impact that it's going to create. And we followed through on that commitment over the years. And I'll just highlight on some of the ways that we've done that. So the clinical trial unit at RMI is one of the first draft accredited clinical trial unit in the province. It has a dedicated team. We're working with a number of leading international CROs. We've got a collaborative arrangements with different organizations within Pakistan and internationally. And in a very short span of a few years, alhamdulillah, it's made quite a mark. Not only are we conducting different clinical trials at the center, it is also a center which is imparting education and running regular courses and programs for faculty and students from all over the region. Just highlights on the kind of facilities that we have. We have a whole floor dedicated for this facility with a dedicated team of phlebotomists, pharmacists, and other team members to carry different trials. Some of the earlier trials that we were actively participating in were associated with COVID. And since then, there's a number of other trials in the pipeline that we're working on right now as well. Since a few years now, we are regularly convening an international conference on healthcare research every year. The edition is coming up soon. The last conference was graced by the Honorable President of Pakistan. We had participation by researchers within Pakistan and internationally as well. The research conference had different streams, and we had participation from all disciplines, whether it's nursing, dentistry, medicine, as well as all other disciplines. Alongside the conference, we also conduct a certificate in healthcare research, which has evolved in recent years in a very short span of time. We now get active participation of trainees from all over Pakistan. We have many trainees from Karachi, Lahore, and Islamabad who come over to join this training program. Another facility that we are very proud of is the Center for Genomic Sciences. So the first NGS in Pakistan was made functional here at the Rehman Medical Institute, and it was our desire to invest in the future of healthcare. We realized that the future of healthcare was changing rapidly. Personalized medicine, genomics was the future, and it is with this understanding that we invested in this facility, and CGS opened its doors in 2016 under the leadership of Dr. Jawhar Ali, who had formerly participated in the Human Genome Project. The Center for Genomic Sciences was also a facility which imparted training to a number of technologists and trainees in different disciplines, and has conducted different activities in terms of diagnostics and research over the years. The center then moved on to evolve into the Precision Medicine Lab. This was a federally funded project at the Rehman Medical Institute, where we partnered with another university, the CCOS University here in Peshawar, which was an affiliate of the National Center for Big Data and Cloud Computing. It is run as a private-public partnership, an excellent example of academia industry consortium. We've got a very smart young team of individuals who've been working on this project for a while now. We've got 5 major groups working on cells and models, clinical data, and machine learning, networks, and hardware. Here are some images of the facility on campus that we have. So we've got a cross-functional team working in different areas: synthetic biology, protein chemistry, molecular biology, microbiology, human cell culture. Some of the highlights, and we've got some very exciting announcements that we're expecting within this year. We're set to launch the multi-omic stack backed by a catalog of primary cell lines for the oral cancer cohort within this quarter. We also have our first drug screen assay for patient-derived tumor cells, which is being rolled in. And then we've got a very interesting Higher Education Commission Pakistan-funded digital histopathology project, which will be releasing a series of 4 cancer image sets for oral, breast, gastric, colorectal cancers in the local population. One of the major projects that the Precision Medicine Lab has been working on has been oral cancer, which unfortunately has one of its highest prevalence in Pakistan. Alongside research and diagnostics, PML has had a Precision Medicine Lab, has also had a very active outreach program. The goal is to sensitize the young population, whether it's medical students, dental students, or even students who are in high school, to give them some exposure on the kind of disciplines that they could explore going forward. So over the years, our summer internship program at the Precision Medicine Lab has attracted some of the brightest high schoolers in Pakistan who are now alumni and working in different parts of the world. We also have a medicine elective for MBBS and BDS students in third year, which is a 6-week elective. Again, a very sought after program, which everyone is looking forward to every year. And each year, the bar keeps getting raised, and students are already excited for the same. There's some images of the different projects that the Precision Medicine Lab works on. So we're working on wearables, we're working on different devices, diagnostics. The PML Hacks is another competition that has been taking place since a few years now. And it is just, the major goal here is to support innovation in our region, to excite young students and to get them to start thinking about some of the challenges that we face. And to start thinking of those solutions as well. So we have some workshops and training sessions, and then we have different stages of the competition whereby students identify different problems, then they're paired together into different groups. And these are cross-functional teams where medical students could be working with someone studying marketing or IT, and then they come up with prototypes, and it's a pitching competition where there is funding as well. And some of these startups are now doing pretty well. Some of them are listed over here: Kitna, Kapi, Carrieline. These are all PML Hacks alumni that have progressed from our center. RMI has had different journals of its own over the years, and I'll briefly touch upon the 4 journals that we have right now. The Rehman Journal of Health Sciences, we've got the Journal of Rehman Medical Institute, RJHS has been around since 2019, and Journal of Rehman Medical Institute has been there since 2015. Soon after the dental college started, we launched the Journal of Rehman College of Dentistry, and we've got a very unique journal for medical students which we've been publishing since 2016. I'd now like to briefly expand upon some of the future goals that we have. The last few years have been very challenging, starting with COVID. Thereafter, the situation with Afghanistan led to a drastic drop in patients from Afghanistan. And then the public health insurance program that existed over here, the Sehat Card program, of which RMI was an integral part of, that largely being discontinued now. So we've been in a little state of transition, but going forward, there's a few areas that we're very much focused on. The first is expanding the portfolio of healthcare services that we are offering. Renal transplant being the last program that we started, we're actively looking forward to starting a bone marrow transplant program and a liver transplant program in the near future as well. RMI now being a mother center, we aspire to make this a hub and spoke model. We already have a lot of outreach activities that are happening, mostly working with the government sector. So Health Foundation is a body with whom we collaborate to operate 4 different centers outside Peshawar, within and outside Peshawar. Those are public-private partnerships, and we intend to expand that even further. We have even more ambitious research goals that we've set for the next couple of years. Rehman University is a project that's been in the pipeline for a while now. We fulfill and comply with all the regulatory requirements for university, and we're very hopeful of being upgraded to an autonomous university with our own charter in the near future, inshallah. And that is something we're really looking forward to, mainly because it allows us to have stronger linkages and collaborations globally and to raise the bar even further with regards to research and educational activities that we're providing. In terms of technology integration, I think technology has been at the heart of everything we've done since starting in 2002. Starting with some of the very early hospital information systems that we established, we've come a long way now, and these are closely integrated with the different functions that we have established. Building up on the solid foundations of genomics that we have, we're now expanding even further into different domains of artificial intelligence and working with different industry partners to see how that could be integrated into the curriculum for all the different programs. We offer undergrad programs in about 16 different disciplines, and we are actively integrating all of these modern subjects into their curriculum to prepare a healthcare workforce for the future. Thank you very much, and I'll be very happy to answer any questions you might have.
Thank you very much, Shaffique Rehman, for a very comprehensive and yet brief overview. I'm sure there's tons of more information that you can provide. And I see that there's a number of questions in the chat box, but I will hand it over to our moderator, Dr. Uzair, and then Dr. Sarwat to share. Answers.
Thank you very much, Dr. Sarfraz, and thank you very much, Shafiqur Rehman. Very elaborate, very crisp, very concise, very professional. So we have yet to see such type of great presentations. So that demonstrate your strength as a manager, in addition to heading a hospital. So it's an eye-opener. My first reaction and question to you is, because you are not trained as a medical doctor, and most of the time, the medical institution are headed by a physician or a surgeon or a medical professional. So you faced with the recent challenge from your patient who were coming from Afghanistan and the health card disruption. And then you embarked on a journey to increase the services. So these are some very structured approaches as a medical doctor. So, you were trained, you were exposed to the global scenarios. So what else can you think of really, which is out of box, rather than just expanding something which is already available? I mean, you mentioned about the liver transplant, bone marrow, which are very, very sophisticated procedure, and lot of challenges. And my built on the same, my second question is, if you are expanding into such critical departments, do you have an easy access to the human resource, with trained human resource, which is required, or you have addressed it? And if the capacity is not there, do you have some strategic plan really to lead such type of initiative? I'm sorry for a little bit more lengthy remarks and questions. So if you like to respond to, please. Thank you. Over to you, Shfiq.
Thank you very much, and I'll try to remember all the questions, but I'll go step by step. I think first and foremost, yes, we had a high-level strategic plan when we started working, and we knew expanding into different healthcare disciplines. But over the years, we've really responded to the challenges we faced. As I mentioned, when we started off, very soon we realized the quality of healthcare standards that we wish to deliver will not be made possible unless we have a homegrown talent pool available to push into the system. And we've just responded to that demand when we said, okay, we can't find enough quality nurses. Okay, let's start a nursing school. We then went into medicine and so on. And now I think most of our workforce is very much homegrown. In fact, we have enough capacity. We're very proud of the fact that most hospitals in KP right now have team members from RMI or RMI alumni who are serving them in different capacities. And these are not just students at RMI, these are people who've worked here, trained in RMI. So that's something that we're very proud of. Other than that, in terms of responding to challenges, so there are challenges that one could have forecasted, and then there were things that we really could not forecast. So I'll just share a little example about COVID. So when COVID struck, we switched to online education instantaneously. Students could not come to campus, but we were very ready for that. I mean, we were not ready for something like COVID striking, but we were very ready for the fact that the world is evolving. Education does not just have to be in the classroom, and we need to enable and leverage all of these technologies to ensure that we're able to impart that over there. Similarly, a lot of healthcare services, yes, we were delivering a lot of care services at home. So we had rehabilitation work happening from home. We had phlebotomists going home from home lab services and so on and so forth. So we could easily scale those up very quickly. Similarly, when it comes to Afghanistan, when we started off, we grew rapidly with Afghan patients coming in, but we knew what our prediction, or rather what our hope was, that sooner rather than later, there'd be enough healthcare facilities within Afghanistan so people don't feel the need for them to come over to Pakistan to avail routine services, regular services. Unfortunately, the conditions, the reasons, things changed, and we had to adapt. And one fine morning, the border was shut down, and 70% of our patients were wiped off. They were no longer there. And we therefore had to respond to that very quickly. So the response comes in a number of ways. As you rightly mentioned, in certain areas, it's just expanding the portfolio of services. And our preference, or what really gets us excited, is bringing services to this region which has not been offered before, for which there is a great demand. And the way to do that is not just bringing in the technology, but bringing in the human resources and establishing a whole system that we then see being replicated all over the province. So when the foundation stone for RMI was being laid in 1991, this part of Peshawar, which is Hayatabad, used to be just an empty space of land. There was nothing around us. We had to actually pay taxi drivers to park their taxis near us, because this is just so outside Peshawar. No one wants to come here. And over the years, I think there's about 8 to 9 hospitals right now in that 1 square kilometer. We consider that our contribution. We feel this healthcare city of sorts that has come up has only elevated the profile of the city, and we're making. So we're very proud of the contribution that we've done to the overall health system and the overall health education in KP. Sorry if you don't mind repeating the next question. I'm not sure if I touched on that.
Yeah. So my question is very simple. You were faced with both of these challenges from the patient who were coming from Afghanistan and the safeguard, the payment. So you mentioned about your strategy to address these issues by expanding the portfolio and the services which were not there. So my question is, there are a few other avenues which are really out of box and they are in the domain of a management person like you. You being, I think, very privileged, and I must say the hospital is very lucky to have the professional management. You understand the difference between a physician, generally they have their limited scope. They may be a great physician, great surgeon, but management is management. Getting the job done from others, that is more challenging rather than, be responsible for your own self. So faced with the challenges where you are the key stakeholder, with the financial constraint to maintain the revenue to run the operation, as you mentioned, to run a hospital is a big challenge rather than having just the infrastructure. So what other strategies they came into your mind which are very innovative and out of box to come out of this and back on the recovery phase? If you would like to have or you thought about that.
Yes, thank you very much. So in terms of healthcare management, I think the traditional model that we've seen in Pakistan, largely in the public sector, the senior most clinician would become the executive director or run the hospital, which is fine, which is the model which has served us very well over the years. But I think gradually people have realized that management requires some specialized training as well. Being trained in a certain clinical discipline is great, and it does give you a major advantage being from that sector. But then you need to have some awareness about business planning. You need to have awareness about what technology is doing, financial knowledge, procurements, and so on and so forth. And I see a lot of clinicians now upgrading their skill set by going for programs and healthcare leadership programs. In fact, some of the programs that I had the pleasure of attending, we had a lot of clinicians who decided that they wanted to switch fields and they wanted to get into management. So even in the public sector right now, there's a number of organizations who have professional healthcare managers. I mean, I can't really choose one against the other. I think all have advantages and disadvantages. For clinicians, at times it is a tough balancing act because management in most cases is very much a full-time commitment, and at least in major organizations. Interestingly, for RMI, I joined the organization a bit later on. I was studying when the organization started off, but over the years, we've never had a medical professional heading this organization, which is very interesting. We started off with a PhD in healthcare management. We then had a former banker, and we've got different professionals, but never a medical professional for some reason. No biases against that, but that's just how it's been. But yes, you're very right. Healthcare management is a very demanding full-time commitment. And I see more and more I see graduates from our medical school now and deciding that clinical fields are just not for them, and this is what they want to go into. In terms of innovative approaches, when you're a private organization, you've got bills to pay. You don't have a government there to bail you out, and therefore you have that added pressure on yourself to make sure things are running well, and you have the right kind of forecast of what's coming ahead. So again, the public health insurance program when it started off, I think it was quite a disruptive program. Unfortunately, it didn't conclude in an appropriate way. It could have done far better. I mean, I'm sure there's lots of lessons learned over there, but we had to respond to those changes in the market. We saw here comes a program, supposedly a universal healthcare program, and we had the option of opting out of it. But then we realized that here is an opportunity for us to give back to the community, to be a part of a public health system which is just newly evolving and emerging, and everyone was learning as they went along to determine how does reimbursement work. So it's all about, I think, teamwork, working in a collaborative manner. We have very regular interaction with all our clinical teams to get their insights, to determine to which disciplines to go into. I think going forward, telehealth is one area that we're really excited about. We feel increasing proportions of healthcare will be delivered outside the walls of a hospital. A lot of healthcare, and I think the technological advances in recent years, exponential technological advances in recent years, whether it's wearables or whether it's all other solutions that are now available, makes it possible for us to deliver so much more to patients sitting at home. And it is very exciting for us for another reason as well. As I mentioned earlier, for many years, we've had patients coming all the way from Afghanistan. And these are patients who have to undergo so much suffering, getting a visa, spending thousands and thousands of rupees to come all the way for a consultation, which we now can deliver remotely. So we're very excited about a telehealth program that we are hoping to launch in the near future to largely serve patients from Afghanistan, but also far-flung areas within Pakistan, eliminating the need for them to physically come over. So there's a lot of interesting opportunities and prospects that we are discussing with different collaborating partners. And I think one has to be resilient in all parts of the world, but Pakistan for sure. You just have to keep looking out, keep evolving and adapting to the changes in the environment. There's very little things that are predictable over here. So the regulatory environment changes rapidly, the socioeconomic conditions. So in recent years, unfortunately, because of the exchange rate fluctuation and all the other challenges that we faced, suddenly the costs just rapidly rose. And it's not very convenient to just pass on those costs to the patient. So then you have to explore different other cost-cutting measures. But I think the key word here is that regular internal communication and that collaborative arrangement with the clinical leaders to be able to respond to these challenges.
So thank you. I think, Dr. Zair, there are a number of questions in the chat.
Yes.
I don't know if you want to get to them, or maybe I can just start out with using the segue about healthcare and healthcare professional. I think one of the questions was about why did you choose to go the other way? So you're saying that the doctors go and get management degrees, but now you were almost a doctor, and then you decided to move on to become a management consultant, and you went into healthcare management. So if you want to share some of the personal reasons, or maybe in general, because I think there are some students here who may benefit from your guidance.
Absolutely. I think what's most important is really pursuing your personal passion. When you're in high school, when you're growing up, everyone has role models. My father was my role model and still is my role model. And therefore I said, yes, medicine is what I want to do, and this is what I want to practice. And getting medical school, it was all very interesting. I really enjoyed it. But very soon I realized that I will get through medical school, but this is not what I will practice. I realized that, 5 years later on, I went to some. I've always been very passionate about technology. I've always been very passionate about management. And I felt, yes, a medical degree would certainly help me. But then I thought, investing the next 3 or 4 years into management programs would allow me to accelerate that journey and get to where I will get, where I want to get anyway. And it was just about pursuing my personal passion. And it was just a decision I made one summer. I said, okay, I've done 1 year. I don't want this anymore. I found my way to England, went there. I think it's just about what excites you to get out of bed every morning. And I love the work that I do. And in a way, it's also about the impact that you wish it. All clinicians have an amazing impact by the patients they see, by the people they treat, but being responsible for an organization or the wider healthcare system, you probably have the capability of doing that, 10x or 50x through the policies that you create, through the systems that you establish, through all the initiatives that you take. So in many ways, it's doing the same work, but probably doing it at scale and doing it in a way that you enjoy.
Thank you. Dr. Zaid, you want to take some more questions?
I think because those questions, they are related to something like social stuff like that. Before that, I will invite Professor Sarwat, really, because he is the guru for the healthcare delivery quality, few words and his comments about these things. Professor Sarwat, over to you.
Gee, thank you very much. First of all, very enlightening lecture, really one of the best that we've had, and a great start for the new year. Since there are lots of questions, I'm going to just say one comment and one question. One comment is that I have a friend who has 2 sons. The older son wants to become a doctor, and the younger son said that I will become an administrator so that I can tell you what to do. The question is, would you tell us, please, Shafiq Sahab, the landscape of hospital administrators in Pakistan, and how many are they? What is their career path in Pakistan, and why should the young doctors think about that program? And the example I'll give you that some of the young doctors go into the civil services and become deputy commissioners and police officers and whatnot. Similarly, I think the hospital administrator path can be very rewarding, as evident by your presentation.
Yes, thank you. And just to add to your first comment, I think it's also a question of work-life balance and yeah, the kind of day that you really want to have. And as I said earlier, looking at my role model, it was very normal for him to take a call at 3 a.m. in the morning or rush for an emergency. And I have massive respect for all clinicians for doing that. But just for personal choices, I thought the kind of life that I want to lead is a little more structured, more family time, more time for myself. And that's just a personal choice. So again, my deepest respect for clinicians. But it definitely requires sacrifices. It's a choice that people do make. And if they're committed to that, and if that's what they wish to pursue, I mean, hats off to them. In terms of the career path, I think things have come a long way now. And we see, undergrads in med school, they're exploring all kinds of alternatives. Some want to go into teaching, some want to pursue the clinical path. There's yet others, as you said, who want to go into public service or research and so many other disciplines. And now more and more universities have come up with master's programs where the entry criteria allows medical doctors or dental professionals or even nursing professionals to get into these leadership programs. I think there's a huge vacuum of healthcare leadership and healthcare management in hospitals in Pakistan, both the private sector and the government sector. So the career opportunities are very much there. And there's also the possibility of balancing clinical work with leadership. I can say that it's challenging, but there's also that possibility. But there's increasing number of programs that are available there. And it's all about personal passion. If it's something, if management is something that an individual is excited about and wishes to pursue, there's increasing number of opportunities, whether it's going into healthcare quality or whether it's going to healthcare management broadly. Some of the leading universities in Pakistan have programs, whether it's postgrad programs, weekend programs, or even full-time programs for that matter. When I decided to pursue this path, when I did my bachelor's, I was looking for a program specifically into healthcare management, international healthcare management. There was very few programs back in 2007 and 8. And the one that I attended in Frankfurt was one of those few programs. It was an interesting program for me because it allowed us to visit health systems in 8 different countries. So we would spend a few months in Germany, then we'd go to Canada, we went to Singapore, we went to India, we went to Austria, UAE, just to have a comparative analysis of different healthcare systems. And just to get a very diverse perspective on how healthcare is delivered in different parts of the world, and to see how we can adapt and modify the models that we have in our own countries.
So thank you very much. I think this really clarifies the situation. As I understood from Professor Sarwat, do you see that there is a good career pathway to be trained as a healthcare management, leader? Because the young one, they are adopting you as a role model, because we have seen in the QA box, somebody is asking, his father is running a hospital and he is a second-year MBBS student. So he is in a crossroad. Really, should he pursue your footstep to move in that direction? As you mentioned, of course, it's the personality issue, it's the priority issue, is the work-life balance. But his question is because at this time, you see the people as a role model. So what are your recommendation to somebody who is young one and is a 50-50, is not very sure, to move into the clinical side or pursue and look for something which is more, challenging, like the healthcare management leadership?
Interesting question. I think there's a number of different variables to consider when making such a choice. I can only share my experiences. One, I talked a little about work-life balance. I'd like to have my weekends. Running organization is no easy task, granted. But once you have a good team around you, in many ways, I consider it a lot less challenging than being a clinician. But other than that, I think um, a good activity would be to explore different areas, go through summer internships, go to an organization and work in any discipline that you're passionate about, whether it's IT in healthcare, whether it's finance in healthcare, whether it's marketing in healthcare, or quality is a new for you, is just to explore those kind of areas. The other reason why I preferred this was the training and the learning path typically for a clinician probably spans a decade or two, if not more. Healthcare management, you start your career a lot earlier. There's different programs that you could do, but you really start your career very early. And of course, it's a lifelong learning process. I agree that you constantly update your knowledge in different ways. I personally consider it a very rewarding path. If it's something that one is excited and passionate about, it's a very rewarding path. Healthcare is growing in Pakistan, and increasingly we see the public sector emulating the private sector in many ways. The corporate structure of management, at least, and I say this for KP, the corporate structure of management having functions such as HR and supply chain and IT and so on, all of those, we increasingly find those in many public sector hospitals as well. Looking at population growth, looking at the demand for healthcare, is just going to grow even further. I mean, people realize there's investors who set up state-of-the-art facilities and excellent equipment, and that key missing ingredient is healthcare leadership. And everyone's on the lookout for quality healthcare leadership. And as I said earlier, having a healthcare education background or a clinical background, whether it's a medical degree or a dental degree, does give you a certain degree advantage. It does give you a useful baseline knowledge. It's not just the terminology, but just understanding how those clinical functions work. And topping it up with the healthcare management skills and healthcare management qualification does make things a lot easier and does add a lot of advantage. So I would personally definitely recommend, but as I said, it starts off with what the passion is and what the long-term goal is.
Thank you. There is another question from Nahal. Our question is that if RMI would be initiating a hospital management program soon, because that's going to be very professionally structured.
Yes, thank you. So we've run a lot of short programs and workshops and courses, many of them in health quality in the past. And we have been looking forward to a master's program in healthcare management. We will definitely be starting one when we get a charter for our own university, but even before that, we are in discussions with various universities. The way educational system is structured in Pakistan, for some of these qualifications, you need to partner with another university. So yes, that's very much on the cards, and we will be launching such a program, inshallah.
So there is another question from Shazia Shah. She is from mental health coach and life coach based in Dallas, Texas. She's complimenting your great work and presentation. Her question is, do you have an employee and student mental health and wellness program on board?
I'm sorry, I missed the last part of the question. The voice was breaking. If you don't mind repeating that, please.
I'm sorry. Yeah. Her question is, you have an employee and student mental health and wellness program on board?
Yes, we definitely have a counseling service. I think healthcare education, whether it's medicals, are very challenging, and students need to have that support available to them. So yes, we've had such a counseling service available for our staff and students since the beginning.
So my next, basically the comment is to Dr. Sarfraz Hasni. Dr. Sarfraz Hasni, you always plan a trip to Pakistan for a grand round and you include Karachi, Lahore. So why not KPK? Now you are connected with the SHAFIQUE Rehman and RMI. So will you be happy to volunteer yourself to include in your destination the Rehman Institute of Medical Sciences?
Absolutely. I'll be honored After listening to today's talk, I've never been to KPK in my life, so it will be a good opportunity to visit. And you know, you were talking about the research symposiums, and I was said, you know, it'll be a good opportunity for me to be involved in something like that, because that's clinical research. That's what I do at the NIH here. So I'll be more than happy. Please, anytime.
Thank
So
you. Looking forward to hosting you.
So that's great, because one of the objective of APPNA MERIT webinar is to connect the people, to provide a platform where, you know, the people who are the professional who are working around the globe, they pledge their support to the Pakistani institutions. So that's a good opportunity. We did explore many such opportunities, and, you know, matching and, you know, getting connected with the leadership to find the way and the capacity, because there is a lot of support from this part of the world. If you are building the capacity in many ways, you know, you are opening up new research activity, new clinical services, collecting the data, and your commitment is very strong, which we can see it with the NGS and new intervention. So by the way, it will be interesting to share that I visited RMI when it was, you know, the taxi stand. So I remember, and I was sharing with Shafiqur Rehman, those when I visited RMI, then, you know, it was just ground. And, you know, I did mention some of the people who are at that point in time working over there. So with this, it's over to Sarfraz, because for the final comments and close up, and thank you.
Absolutely. So thank you so much, Dr. Sayed, for being the force behind all these webinars, and Dr. Sarwat, for your comments, and always have some cheeky anecdotes that he had. But again, it was an excellent start out to our year of new series of webinars. So just a reminder, we do it every 2 weeks. So we will be back with another webinar in about 2 weeks from now. So please be on the lookout and follow us on our YouTube channel. And thank you so much for Shafiqur Rehman, and also for RMI for their services, and for your time and your passion and your commitment to healthcare improvement and healthcare improving the outcomes in Pakistan. So with that, I know that we have a few more questions, but maybe we'll try to answer them offline if possible. But we like to end within our allotted time. So thank you again, and thank you to the moderators and participants, and again a big thank you to RMI, and thank you so much.
Thank you all. Thank you.
Thank you very much for that.